Welcome to today's discussion on esophageal diverticula, a condition that might sound a bit obscure but can significantly impact a person's life. We'll explore what it is, why it happens, how it's diagnosed, and what can be done about it. So, let's dive in and unravel the intricacies of this fascinating condition. Now, let's talk about what causes these patches to form. The exact causes of esophageal diverticula aren't fully understood, but they are generally believed to be related to weaknesses in the esophageal wall. These weaknesses can be congenital, meaning present at birth, or more commonly, acquired later in life. Increased pressure within the esophagus, often due to swallowing difficulties or esophageal spasms, is a major contributing factor. Think of it like an inner tube that has a weak spot. Repeated inflation makes the weak spot bulge outward. Certain conditions that increase pressure in the esophagus, like achalasia, or those leading to inflammation, can also contribute to the development of diverticula. So, how does an esophageal diverticulum actually develop? It's all about pressure and weak spots. High pressure within the esophagus forces the inner lining, or mucosa, to herniate outwards through a weak area in the muscular wall. This creates a pouch-like structure, the diverticulum. Depending on where in the esophagus this happens, the symptoms and potential complications can vary. Over time, food and secretions can accumulate within the diverticulum, leading to inflammation, infection, and other bothersome symptoms. Esophageal diverticula are relatively uncommon, making it difficult to pinpoint exact prevalence rates. They are more frequently diagnosed in older adults, particularly those over the age of 60. Certain types of diverticula, such as Zenker's diverticulum, are more common in specific populations. Due to its often subtle symptoms, it's likely that many cases remain undiagnosed, leading to an underestimation of its true prevalence. The symptoms of esophageal diverticula can be quite variable. Many individuals may have small diverticula that cause no symptoms at all. However, as the diverticulum grows, it can lead to a range of uncomfortable issues. Common symptoms include difficulty swallowing, known as dysphagia, regurgitation of undigested food, chronic cough, hoarseness, and bad breath or halitosis. Some individuals may also experience a gurgling sound in the neck, especially after eating. In more severe cases, the diverticulum can lead to aspiration pneumonia, where food and liquids enter the lungs. Diagnosing esophageal diverticula typically involves a combination of imaging and endoscopic procedures. A barium swallow study is often the first step. Here, the patient drinks a barium solution, which coats the esophagus and allows X-rays to visualize the diverticulum. An upper endoscopy, where a thin, flexible tube with a camera is inserted into the esophagus, provides a direct view of the esophageal lining and any diverticula present. Esophageal manometry, which measures the pressure and function of the esophagus, may also be performed to assess for underlying motility disorders. Esophageal diverticula are generally classified based on their location within the esophagus. The most common type is Zenker's diverticulum, which occurs in the upper esophagus, just above the esophageal sphincter. Midesophageal diverticula are located in the middle of the esophagus, often near the site of previous inflammation. Epiphrenic diverticula are found in the lower esophagus, just above the diaphragm, and are often associated with esophageal motility disorders. Each type has its own unique characteristics and potential complications. Treatment for esophageal diverticula depends on the size of the diverticulum, the severity of symptoms, and the overall health of the individual. Small, asymptomatic diverticula may require no treatment at all, just careful monitoring. For larger, symptomatic diverticula, treatment options include surgical and endoscopic approaches. Surgery may involve removing the diverticulum or suspending it to prevent food from accumulating. Endoscopic techniques involve using specialized instruments to cut or staple the wall of the diverticulum, creating a wider opening and allowing it to drain more effectively. Lifestyle modifications, such as eating slowly, chewing food thoroughly, and avoiding lying down immediately after meals, can also help manage symptoms. Unfortunately, there is no definitive way to completely prevent esophageal diverticula, as the exact causes are not fully understood. However, maintaining a healthy lifestyle, including a balanced diet and avoiding smoking, may help reduce the risk. Prompt treatment of any underlying esophageal motility disorders, such as achalasia, may also help prevent the development of diverticula. Being aware of the potential symptoms and seeking early medical attention is crucial for early diagnosis and management. The prognosis for individuals with esophageal diverticula is generally good, especially with appropriate treatment. Most individuals experience significant symptom relief following surgery or endoscopic intervention. However, there is a risk of recurrence, particularly with larger diverticula or underlying motility disorders. Ongoing research is focused on developing less invasive and more effective treatment options, as well as gaining a better understanding of the underlying causes of esophageal diverticula. Recent advances in endoscopic techniques have shown promising results in the management of these complex lesions.